As healthcare workers, we know hand hygiene is the single most important way to prevent the spread of infection. Just like the 5 rights of medication administration help nurses administer medication safely, the 5 rights of hand hygiene help ensure that healthcare workers have the cleanest hands when caring for patients. They include choosing the right product to clean hands, using the right amount of product, doing this for the right amount of time using the proper technique, performing hand hygiene at the right moments, and making sure the right people are performing hand hygiene. Let's briefly discuss each of the 5 rights of hand hygiene, and then we will provide more in-depth education into a few of these areas. First, you must choose whether alcohol-based hand sanitizer or soap and water are the right product choice for hand hygiene. The Centers for Disease Control and Prevention and the World Health Organization recommend washing hands with soap and water if hands are visibly dirty or contaminated with blood or bodily fluids, and recommend using an alcohol-based hand sanitizer as the preferred means of performing hand hygiene if hands are not visibly soiled. Second, you need to use the right amount of product. There is scientific evidence that supports the need for using enough product to ensure that your hands are adequately clean. Just like a medication, it is critical that you use the right dose of alcohol-based hand sanitizer in order to achieve the desired outcome, which is adequate reduction of germs on your hands. Third, you need to perform hand hygiene for the right amount of time using the proper technique to ensure that you are effectively removing germs from your hands. We have included videos in this kit demonstrating proper technique. Fourth, you should perform hand hygiene at the right moment where patient care is provided and transmission of microorganisms is most likely. The WHO 5 Moments of Hand Hygiene focuses on these key moments, and the CDC guidelines describe key clinical situations where hand hygiene is warranted. The WHO 5 moments are 1. Before patient contact, 2. Before an aseptic task, such as starting an IV, 3. After body fluid exposure risk, 4. After patient contact, and 5. After contact with patient surroundings. The CDC recommendations align with the WHO 5 moments. Finally, it's important to make sure the right people are performing hand hygiene. In the past, the primary focus of hand hygiene efforts have been centered around nurses and other healthcare workers. However, patients and visitors also play a role in the transmission of microorganisms and should be educated on how and when to perform hand hygiene.